Hey, so I've had a request for the axial skeleton to review it. So I'm going to go through that with you right now. It's on page 16 of your book. If you look at page 16, you'll see that the hyoid is listed there. I'm not going to show you that one. It's a U-shaped bone that's located right here. Remember, it has no bony attachment. It helps anchor the tongue. It has a ligament that's going to attach it to that styloid process of the temporal bone. Now, let's start off with something simple, right? So you have the rib. So when you look at the rib, you're going to have a smooth end, right? And then you'll have this other end here. And this other end has more of a rough shape to it. So the way I remember this one is that if you're going down the shaft, the smooth end is sternal. So smooth sternal. Sternum is in the front. So it's the anterior end, also known as the sternal end. The back portion, which is the more rough area, is your posterior end. Because it attaches to your vertebrae, it's going to be known as your vertebral end. So that makes sense. You're going to see that there's a hump here. You are at the neck when you pass up that hump. And when you get to the end here, you are at the head of the rib. So if it says name the structure, if you're over here and it says name the structure, you're going to say it's the anterior end or the sternal end. If it says name the bone, you're going to say it's the rib. On this end, if it says name the structure and you're here, it's going to be the neck of it. If you're here, it's going to be the head. If it says name which end you're on, it's going to be identified as the posterior end or the vertebral end because it attaches to the vertebrae. Where it attaches to the vertebrae, it's going to be a thoracic vertebrae. So you have a thoracic vertebrae here, right? And we know it's thoracic because it has these extra little humps here on the body. So you see where the pedicle attaches to the body. This hump and this hump, these are known as costal facets. And costal in Latin is rib. So costae is rib. So you know that's what this is. And that's only going to be found with these thoracic vertebrae. Now, all right, so now let's go over this one. It has broken apart, but what it would end up doing is connecting like this, all right? So move my fingers for you. All right, so what you're looking at here, this is going to be your sternum. So we're talking about here coming down. All right, the top portion is the manubrium. This portion here in the middle is known as the body or the gladiolus. And then this portion here is your xiphoid process. All right, so that's just a very thin process here. Let's go ahead and look at this one. So what is this bone? If you said sacrum, you're right, it's the sacrum. So where is this at on your body? Well, it's located at the base of your vertebral column. The sacrum has several structures that you have to know. It's also one that's helpful. You can identify male, female if you have the sacrum because the male and female will differ a little bit. How this curves here will vary. So if you're looking at this one, you're trying to figure out what are the structures I have to know. Well, the first structure is right here. All right, you see kind of like that 7 shape. So it might be a mirrored image 7 for you. All right, so this area here is where your os coxae will attach. And I'll do a video in a little while that'll show you the os coxae. And it'll also identify on it where this structure would attach. So this is your articular surface for your sacroiliac joint. If you go to the chiropractor, they'll say, oh man, let me adjust your SI joint. Well, that's sacroiliac, SI. All right, so sacroiliac joint forms there. If you're looking at it this way, there are a bunch of holes coming down. You see all those holes? All right, so these holes here, you're on the sacrum. It's a bunch of holes, so we say it's foramina. So these are your sacral foramina. Up here at the top, all right, it's on top, so it's superior. These are articular processes, all right? And then the bone, if it says name the bone, it is the sacrum. Let's look at some vertebrae. Okay, so the vertebrae, I love the vertebrae. If you're looking at the vertebrae, you have 3 different regions that they can come from. All right. So you have your cervical vertebrae here at the neck. You have your thoracic vertebrae that we spoke about a second ago, the ones that have the rib articulation with it. And then you're going to have your lumbar vertebrae. Your lumbar vertebrae are your lower back vertebrae. So this is going to be a lumbar vertebrae. Right? The identifying characteristic for lumbar is that it has a very large body. This is also known as the centrum. It's going to have a vertebral foramen. All your vertebrae have a vertebral foramen. This is where the spinal cord would go through. Right? And then most of the other characteristics that it has are also going to be identified on your thoracic vertebrae. Right? So lower back, lumbar, big body. Compare it to a thoracic vertebrae. All right? Smaller body. Right? Here's how I remember these. Your thoracic vertebrae are definitely thoracic because they have these extra set of humps here. Remember the costal faucets? That's where the ribs attach. These structures in your lab manual that you have to know for this are going to end up being your spinous process. Right? If I look at this one right here, what I see is a giraffe. Right? This would be the nose of the giraffe. These are the ears. These are the horns. All right. When I look at this guy, he looks kind of moose-like or a rhinoceros. The giraffe is definitely thoracic. So when you look at your thoracic vertebrae, you have the nose of your giraffe, makes up what is the spine. Most people refer to as the spine on their back, right? Each of these. So when you put those words together, you have spine and nose, and this is your spinous process. The ears are your transverse process. The horns are on top. They're your superior articular surface or superior articular process. If you have a superior, you probably have an inferior. So if you were to flip this guy over, right, there are these little teeth-looking structures. So where the giraffe's teeth would be, that is your inferior articular surface. You have the cheek of the giraffe. When you laugh, your cheeks get big. Starts with an L. This is your lamina. The structure here, the bridge that attaches it to the body, is your pedicle. And that is this one. You're done with thoracic. Those same structures are going to repeat on this guy. So the nose of this guy, spinous process. His little teeth-looking thing here, that's your inferior articular process or surface. The horns up top, superior articular surface. The ears, transverse process. The bridge that connects the transverse to the body is your pedicle. Pedestrians walk across bridges, right? You can pet your pets behind the ears, pedicle. When you laugh, your cheeks get big. That's the lamina. The vertebral foramen, hole in the vertebrae, there's the hole in the very center there. That's where the spinal cord goes through. You're good on these. Let's look at some cervical. All right, so the cervical vertebrae, your first and second cervical vertebrae actually differ some. So they have some unique characteristics to it. They're going to allow you to rock your head and do your no-no. All right, so they have to have those unique characteristics. When we look at those, you have a C1, C2, cervical 1, cervical 2. See this guy? When I look at it, it looks like shoulders. And I think about the God who held the world on its shoulders. This is my C1. It looks like shoulders. It holds a skull on it. It looks like a world, a ball, right? And so who is that Greek god? That's going to be Atlas. So this thing is known as Atlas. Your C2 looks like this. This is axis. It has a pole, just like the earth revolves around a pole. All right? Your head's going to revolve around it. This is known as axis. it's your C2 vertebrae. It has this ODOT process here, known as the DINS. All right. Cervical vertebrae, the thing that's unique about those is that they have, on the transverse process, a hole. And so this is known as a transverse foramen. You'll see that on both of them. That is an extra set of holes. That extra set of holes allows for the spinal nerves to go through them. So this is another cervical vertebrae a little bit further down. And you can see those extra holes there too. I hope the axial skeleton is a little more doable for you. I am going to post some more videos to help you out. I'll go over the long bones, and that way you can look at those. So especially the long bones of like the arms and the legs. And so check out those videos too. All right, you guys have a great day.